Yeah, so our current understanding is that progression independent of relapse activity perhaps is a consequence of acute inflammation, but leads to this concept of chronic in the CNS that, in a sense, becomes independent from peripheral T cell activation or B cell activation. When you look at certain pathological studies, they are showing us that, for example, certain cells like B cells and T cells cluster in the intermeningeal spaces in MS patients. Early on, we thought that was only in the secondary progressive MS, but now recent studies have shown us that actually that presence of B cell and T cell clusters occur earlier in the process of MS. And they resemble the secondary lymphoid structures, and that's why they are called tertiary lymphoid structures, or some names that have been used, of course, are B-cell ectopic follicles, or so on and so forth. So those are all synonyms. It's not clear what role they play, whether it is pro-inflammatory role or kind of like to perpetuate that chronic inflammation in the CNS, or perhaps they play some degree of anti-inflammatory role. However, these tertiary lymphoid structures have been linked to certain lesional activity in the cortex, with particularly sub-PL lesions, leading to the thought that perhaps they do play a role in inflammation. Other markers for chronic inflammation, as I mentioned before, is the presence of activated microglial cells in the periphery of chronic lesions, perhaps leading to that constant chronic inflammatory process that on MRI could be seen, as I mentioned before, by the process of paramagnetic rim or also slowly enlargement of those lesions.